Studies, the first holistic health program at a public university in the United States. Dr. Peper is president of the Biofeedback Foundation of Europe, former president of the Association for Applied Psychophysiology and Biofeedback and the Biofeedback Society of California, and was a sports psychologist for the U.S. Olympic gymnastics team for 4 years. He is the author of numerous scientific articles and books. Dr. Peper lectures and teaches frequently all over the world and directs a biofeedback practice at the Biofeedback Health in Berkeley, California. Please welcome Dr. Erik Peper.
Thank you so much for the kind introduction. And what I'd like to do today is talk about a few concepts which underlie possibly health and which I have forgotten many times. And in many ways, it's remarkable to be back here because in 1976, I gave my presidential address to AAPB. At that time, Neurofeedback and Biofeedback were one group. And I still like that sense because mind and body are always together in that sense. And just to show that we did do some work at that time, this is my early incarnation, spending probably 20 hours a day, 15 hours a day doing EEG work, studies with alpha training, etc. They're fun. I also did a major change probably is that we usually not only train subjects, but whenever we ran the subjects in a light-proof, soundproof room at that time, a Faraday cage, we got the recording. And when I didn't understand it, I didn't understand the EEG, I would go back in the room and try to create the same EEG as the clients. And so you could see we did get some control. There were many studies we published with Thomas Mulholland, who truly was my mentor. And here's a study which one of our subjects, we had a number showing you can control one hemisphere turning alpha on and the other one turning it off at the same time, back and forth. So that was my interest. But really my interest is much more, what can you do? Because I learned one lesson out of all that training. I probably spent hundreds of hours doing this. And I really learned to control my EEG very well at that time. That's occipital alpha, right and left. And what I could do, I could send Morse code. I could keep one side off. I could turn the other one on. And this was all done via ocular motor activity. So they were a totally different approach than many of you use now, but a way to change the visual commands. And I became very good at that. And then I got tired one day driving, going skiing, and all of a sudden my brain just turned into kind of alpha. Thereby I saw two roads. And driving, that's sort of interesting, as if both eyes became independent. And then I realized, I need to respect my biology. Just because you can control something doesn't mean it's health. And since that time, I realized mind and body are interconnected. You can listen to the body to change the mind or brain, and vice versa. And my interests are really, what are the possibilities of health? And in that sense, I've had the opportunity since 1970 or 68 or so to study unusual people who have voluntary control of pain or bleeding or healing and ask, how do you do that? Because I'm intrigued, how can my clients do that? Then as I teach at the university, where we teach thousands of students, the question is, how can the students mobilize their health so they do not develop future illness? And what pragmatic skills can we do to achieve health? So that is the concepts that run in my head in many ways. And before I go on at all, just look at the person next to you for a moment. Just look at them. And then look at them and realize that only 10% of them are human cells. 90% of all the cells in your body are bacteria, parasites, etc., whatever it may be. But we don't think of it that way. We look at myself and I say, I'm human. And then I realize, as a biologist, only 1/10 of me are human cells. All the other, I live with in harmony, hopefully, and then I stay healthy. And that started to remind me that I need to think more of biology or more how can we heal. So let me show one or two studies for fun for healing on that concept differently, because I was invited to study some Sufis who had voluntary pain control. And they stick swords through their bodies. They don't sterilize them. We pass them around the room. Then they insert them. They pull them out. It doesn't seem to bleed in most cases. It heals quickly, and there's no infection. So here they were hammering knives in someone's head. I'm not recommending this. But when they take it out, you see there's no bleeding. That's literally a couple of minutes afterwards, as they're sitting in front of me. Or here they're sticking a minor skewer through. If I find a better pointer, it would work better if you have one there than mine. 12 o'clock. As you can see, he's putting this little skewer through his jaw. And then moments later, when he takes it out, you see it is bleeding. And then it heals. By 14 hours later, it's totally healed with no infection. And this lovely skewer is passed all around the audience. I'm intrigued in that. And the question is, what allows you to heal? What allows you to mobilize your health? And I think at least there are a couple of perspectives. One, we must respect our evolutionary origins and live in harmony with that. That's one. That's the simple message I'll give, nothing else. And the second, for healing, you must have total faith or total trust. You must feel safe. And when you feel totally safe, you're more likely to heal. Maybe you move into a parasympathetic dominance or whatever. And since I thought of that, since I was at the same meeting, they said, do you want to do it? So I said, sure. Why not? So you see, I can equally do it, and then you do it. And out of that, we looked at other people who do all this. Now you can see it still. You see it's possible. Any of you can do it. And I get intrigued how people heal, how can you apply it. So we've also used it to illnesses like cancer, etc. But what is my focus of my presentation? As I said earlier, you want to respect your evolutionary origins. Many dysfunctions can be reversed or prevented, really, by living in harmony with that. Healing is promoted when we are safe, and there are many simple behavioral lifestyle changes that can make major changes, whether it's from cancer, heart disease, eczema, and I would say attention deficit disorders. Remember, we started here. Our bodies are still that way, and now we end up here with a largest cortex. Okay, and then many of us in that process develop aches and pains. You know, when you go to the physician, what we see is that there are many different illnesses we have to the healthcare providers. You can see for chest pain, fatigue, dizziness. And the black little component on that graph is where we know there's some physiological dysfunctioning. The rest we don't know. And it's always shocking to think that in most cases, the etiology may not be understood. And so it may be due that, and then what we do is we treat it with medication, which may in fact contribute to the problem. So let me talk about that also for a moment. We want to teach skills, not pills. But let me look at the medication for all those treatments. As all of you know, sleeping medications increase mortality. That data is overwhelming. There is no medical reason except for crisis epoch to prescribe sleeping medications. They are all harmful if they're used over a long time period. You know that. You all have known those who have high cholesterol may take statins. Yes, statins are great to lower death rate from heart disease, except the total death rate doesn't change. So you're dying for something else. And as many of you know, you have a risk of increasing muscle pain, you have a significant risk of developing type 2 diabetes, and more importantly, as the FDA pointed out this year, you have an even bigger risk, which people already knew, of having forgetfulness, confusion, etc., which leads to car crashes and other things. So that's why the death rates have stayed the same. Okay, but now let's go more to the area many of you deal with, I suspect, or we all deal with, is with younger students or people. And here's the percentage of Americans under 20 who are now taking stimulants or antidepressants. And you can see over the last 15 years or so, it has radically increased. And so has juvenile bipolar diagnoses, as many of you know. There's an interesting part of that. The prescription rate has massively increased, as you can see very well here. And so has the disability. And if any of the treatments worked, the disability rate should have leveled off. And so we know that it looks like that the medication itself is iatrogenic. Let me give us an example. And you know this for attention deficit disorders, at least when you give Ritalin, Adderall, that no research studies, long-term studies have shown no improvement for school achievement, no reduction in behavior problems. When taking off the meds, the children do worse. And when you take the medication, overall your height shrinks. So that's, I think, the best cell I can think of for neurofeedback or any other type of feedback strategy. And then I work with the anxiety, which many patients have, or many of my students have anxiety. They quickly would be prescribed Xanax or anything else. This is the FDA trial where you can see very eloquently, Xanax works. Look at it. The number of panic attacks decreased perfectly. Very nice compared to the placebo. What the FDA forgot to tell you, what the drug company forgot to tell you, is basically when they withdrew treatment, that is at this point here, people got many more panic attacks, and look at the placebo group stayed the same. And so you can argue this from a kind of biomedical perspective or physiological perspective why this works, but this distinctly suggests that Xanax is probably not too recommended. Anyway, and then the questions really started, I got intrigued, is how come so many of you, not you, at least if your hair is great, probably not you, gray, but if you have children, how so many have hay fever? How many have kids who have hay fever? Or asthma, allergies, right? It's the, you know, what is so intriguing when you look at that data, hay fever was first described just about 200 years ago. And it was a disease associated with affluence. If you lived in the city or in a castle, you did not work, you got hay fever. IBS and Crohn's disease is very similar. It wasn't really described until 1932. And yet, the rate has increased from 1 per 10,000 to 1 per 250 in the last 50 years. It's not existing as a disease in any of the underdeveloped countries. It only is associated with high affluence or industrialization. I'm intrigued in those questions. I don't know why. Okay? So how come so many people have the autoimmune disorders? Cognitive, asthma, allergies, IBS, Crohn's disease, multiple sclerosis. I'll put it in the same category. Eczema, ADHD, arthritis, food allergies. How come these diseases are mainly absent in non-Westernized cultures or in rural worlds? How come these diseases are occurring more and more earlier? And to me, those are intriguing questions because as a biologist, it makes no sense. Our genetics, I'm pretty well the same as my parents, I think. And then you look at other illnesses. So here you look at the most recent data, or fairly good data, of the drop, which we all know about because of immunizations, of hygiene. Look at the drop in rheumatic fever, hepatitis, measles, mumps. That's the graph on the left. Look at it. It's mind-boggling. And look at the mirror image of that. As these disorders decrease, we get a simultaneous increase of type 1 diabetes, asthma, multiple sclerosis, Crohn's disease. You know, it's a way food for thought, let's say it that way. And remember, simultaneous at this time, there may be light at the end of the tunnel. Okay? And at the same time, other things were going on. So the major part is maybe those diseases can be ameliorated or prevented if we live our evolutionary roots. That means, you know, we need to learn to modulate our fight-flight responses. We are still wired that we were prey. We need to change our diet away, which I'm not saying, I'm talking to the choir, I suspect. We need to check the pollution of these lights. And I'll talk about that for a moment. We need to remember that we live in harmony, in mutualism, with all the bacteria in our gut, which control much more of us than we think. We need to live back in nature, and we must do movement and rest. But I realize, let me keep going for a sec. So there are many things. So let's look at another curve like this. That should have been earlier. This curve just shows what happened when we started to do measles vaccinations. Notice we vaccinated at a time when measles really didn't cause almost any deaths. But this is a time period when we started to vaccinate that all the other diseases occurred. I am not saying don't vaccinate for polio. I now become more questionable to say, when we vaccinate or when we avoid anyone having fever, we may in fact be harming the immune system. That's a hypothesis, and I can give lots of data. So remember this. Iatrogenic illness due to fever suppression and medication. These are large British studies. Children who never developed high fever, that means they usually get medication. 30% develop food allergies, hay fever, contact dermatitis. Children who experience episodes of childhood fevers, only 5% develop allergies. Keep that in mind. And remember, if you talk to your grandparents, they all had fever. They went through childhood, they had the measles, they had these those 4 or 5 childhood illnesses with high fever. And as if that was a part that was necessary to activate and mature your immune system. We may have forgotten that. And then when we give medications, this is from about 20,000 patients in Britain by McBride, that if you give Tylenol to moms during pregnancy to reduce the fevers, and then give it in the first year of life to the child to reduce fevers, you see a significant increase in asthma, nasal illnesses, eczema, all these kind of immune incompetences. And I sometimes wonder if that also applies to other body functions. Okay? And now take this model that we have moved away from hygiene. An argument I would waive, and that's the most recent research right now, is that many of our immune illnesses are the result of your cleanliness. Every time we wash our hands with the antibacterial soaps, every time we don't allow the kids to play in the woods and not get worms, that may in fact cause our immune system to get reactive. Remember, for millions of years, just like the great apes, we had worms, we had parasites, and they lived happily with us, believe it or not. I know, imagine having hookworm once again, or whipworm. That's what your grandparents had when they were in the 1920s, about half the population of the United States had this at times. And then at the same time, there were almost no immune disorder diseases. And that is interesting. Taking that model that we always lived for millions of years in harmony with our physiology, with our parasite, who we hosted very nicely, and they modulated our immune system as well back and forth, that if we now live in a hyper-clean environment, we may in fact get more sick. And this is now the work by Weinstock and many others. It's probably the newest area of medical research from my perspective as a treatment, that if you reinfect patients with Crohn's disease, for which we know there's almost no cure, with something like whipworms, just what you would want. These were initially done from pigs, so they allegedly will not go anywhere else. Or if you give yourself some hookworm, then all of a sudden your allergy rates go down significantly, as if it readjusts the immune system. I want to keep this in mind as a concept. Maybe we should be living more part of nature. Okay, if you're intrigued in any of these concepts, there are 2 new books out. The Epidemic of an Absence, I highly recommend, which is a scientific one, and a popular version of this is by Robert Dunn, called The Wildlife of Our Bodies. It is mind-boggling when you start thinking about your GI tract or your whole body, how much it's co-hosted. Okay? Remember, we need a change in perspective. As I said earlier, only 10% of us are human cells. And so, I don't know. But before, and thinking of a shift in perspective of health, maybe what do you all see here? I'm intrigued. What do you see? You can speak out loud. What? You see how many of you see a couple? Most of you, right? I don't know what you're seeing in the world. Science demonstrates that children see 9 dolphins. They're not able to discover the loving couple because their minds are not just so concerned with things of making love and sex. You want to see it again? It is. You see, here's the couple, obviously, but look at this lovely dolphin just between her legs. Look at this lovely dolphin on the side. Look at the dolphin. Notice, we just want to see what we choose to see. And so that is a shift in perspective. So remember, on that note, the 19th century illness was mainly infectious childbirth trauma. The 20th century illness is related to the separation from our evolutionary past. And I want to talk about that. 1, we have to keep remembering we were prey. Our bodies are wired. We are prey. I know. We still are just like this. Our amygdala still reacts 22 milliseconds quicker than our cortex if danger occurs. Remember, thousands of people are still eaten alive by crocodiles. And this person did die. And this one, I don't know the story from. But then it's no longer that. It's just your office. It gives the same response. Or it's getting not enough space at work. Or stress. And you all know the work, my guess is by Porges, am I correct? Are you familiar with the work by Porges? Put your hand up, yes, no? Stephen Porges, which I highly recommend as a way to look at the world. That namely, remember, and I've shifted my way of thinking out of that we have an environment, somehow stimuli go in, we have a nervous system. If I ever make it work, here we are. Information goes in, and we don't just we have 3 divisions we make in 20 milliseconds or less. We decide, is the world safe? That causes us to reinterpret the world totally differently. We decide if the world is dangerous, that's our classical fight-flight response, or if it's life-threatening, and we give our reptilian response where we close down. There are different biological patterns, and that occurs instantaneously. Maybe I should give you the experience how quickly that occurs. Is that okay? So let's see if I can do this by showing a little video clip. You may have seen this video clip. It's one of my favorite video clips. I borrowed once. The volume should be somewhat high as this goes. And let's assume the volume works. That's going. A little more. And the reason of showing this little video clip is that many of you noted during the first one of the taxi ride, they're the same video, visual input. All that was changed was the auditory channel. In the first one, the world looks dangerous. You didn't know it looked dangerous, but you interpret it that way. Am I right? And the second, the world looks safe. Our brain makes those decisions instantaneously, and it colors all our cognitions. So become aware, at least for clients and myself and students, that that is a possibility. So I think I'll skip these. And this is the whole work of of Porges, but basically the sense is that first video clip moves me right into vigilance, into life protecting. Well, the second component of that video moved me to, the world is safe, I can nurture, I can regenerate. As a therapist, which do I trigger in the interaction with the equipment? Am I triggering that safety, or I trigger that vigilance? Okay. So healing begins when we feel or we are safe, I would think. And so let me give an clinical example of this concept. Here's a 47-year-old woman with chronic pain, tightness in epigastric region. We're just doing a little study. She also has some challenges in doing cognitions. We did a very simple reading task or a math task. Many of you have done that before. Just subtract the number 13 sequentially from 949. And here's a physiology. This is not looking at the EEG. This is looking at respiration. And here you can see she inhales, she exhales. This is her chest. This is her abdomen moving. So you can see she's balanced on both. She breathes a little bit quickly, not too bad. Inhale, exhale, inhale, exhale. A little short breath. Inhale, exhale, inhale, exhale. Now the test is going to start. She takes a gasp, holds her breath the whole time. She is frozen in fear, although on the outside you may never see it. And when the task is over, she goes back breathing. But you can also see that same fear reaction in her physiology in her neck and shoulders. So here you do a recording from her scalene to trapezius, and you see the muscle tension in her shoulders. And as all of you know, just when someone stands behind you, you know how you feel your shoulders slightly tightening, the trespass reflex, that fear reaction that goes like this. She does the same thing. She didn't know any of that occurred. She had no idea she held her breath or shallow breathed. She had no idea she tightened her shoulder a tiny bit. And notice how little effort that takes. But what happened when she did this task? She felt rushed, blanked out, and couldn't do the math. That's all. She has learning disability. Does she really? Maybe she just is too stressed. This tells me you have been sitting much too long. From an evolutionary perspective, you see, you want to move. So why don't we do a little exercise? Is that okay? So I'd like you all to just stand up. And for a moment, I'm going to be crazy for a moment. Just jump, do some kind of, jumping jacks. You know how easy it is? You can do really high, Oh, you can do it too, honest. That's enough. And now I'll let you sit down again. But I'd like you just to check for a moment, did your energy level go up a little bit? Yes? Notice so often when you work, at least when we work with students in school or people at the work site, they are exhausted, their brain goes blah. A momentary exercise will significantly increase energy. Now, I did not look at the component how you jumped, and I'll ask that maybe later. Okay? And I'll show the data of studies like this in a moment. But then what we did, so going back to this woman now, the test triggered, you could say, a fear reaction. She held her breath, she tightened, possibly she got some anoxia, but very short. You could say she has learning disability. What we then did is said, well, let's look at your physiology. Remember, mind and body are not separate. I want to keep that point. So the question I'm asking really is, what's the cheapest intervention? What's the quickest intervention you can do? And so we taught her how to breathe, practice many times. She could do it. Then to repeat the test, and here she does the same test. Afterwards, I am not saying all students are like this, but we have seen many students at San Francisco State where we do this that works this way. Here now she can breathe lower in her abdomen. She's breathing slower. Here she does the math test. She doesn't give the fear reaction. And what did she feel then? She felt calm, good, able to think. She could do the math sequentially. And she realized in that little experiment how often she reacts in the world this way. And then it becomes mastery training how to do it differently. And if there's any point I want to make is that breathing as one pattern of many affects the EEG and affects health. Okay? So maybe I could think of learning disability. So before doing EEG neurofeedback training, I would do these very simple behavioral interventions. You know, because when we are stressed, oh, I forgot about this. Listen, honey, I know about being stressed is dessert spelled backwards. What we do eat lots of sugar. Is that familiar? So I don't know how many of you know this graph. Any of you? Let me explain this in detail because we use this a lot with our students and patients. It's a very old study. I know, it's in 1947 with healthy people. And all what they did is they record the EEG, notice, and it goes from 10 hertz to down to about 3. And these are healthy people. And then what you do is you just take this nice subject, you give them an injection, basically a bolus of kind of sugar, blood sugars. Now you increase it massively. Now they have 200 milligrams per. And now what happens is you have the person be stressed or hyperventilate. Is that clear? The brain, you could say, is now bathed in glucose, highly recommended in that moment. And there is no change, which is interesting, in the EEG. Basically, very little. The frequency doesn't go down. Remember, 3 minutes of hyperventilation is fairly vigorous. How many of you have done that? Remember you used to do this in junior high school? You hyperventilated each other and then you squeezed and you fainted? No? Do it next time. It's fun. No. Remember, breathing is a major component which we forget about. Remember, to identify patients potentially having epilepsy, you do a fasting EEG and you have the person hyperventilate to see you can evoke seizures. If you can evoke seizures that way, I never understood why neurologists didn't say, if we can evoke it, maybe we can treat you by changing your breathing pattern. And that's the work by Robert Fried and others, obviously, who think that way. But notice now, here, I want to point back to this graph here very nicely. Here's the end of the infusion. The brain there's high glucose circulating, no problem. Now you wait 2.5 hours later. Now you get the kind of hyperglycemic reaction, in this case because you get this giant bolus of sugar. Now the body dumps massive insulin. All the insulin takes the sugar back. Now the level is very low. As you can see here, 76. Now you repeat the same test on the person. Identical test, there's no difference. And look what happens. There's no difference at baseline. You cannot tell anything. However, if you have the person hyperventilate, look what happens to the EEG, mean EEG frequency. These are all the patterns you would see when people talk about attention deficit disorders, theta patterns or others, seizures of delta present. And you can induce this in almost anybody. Now, in between are the different curves when you have fasting, 1 hour fasting or 3 hours. And in our limited experience with people who have panic attacks, especially when we work with the university, many of the students have triggered their first panic attack when they were exhausted, may have had too much sugar or didn't eat at all, drank lots of coffee, and then were faced with their stressor. Because what happened is the stressor, they got nervous, they reacted, they breathed too quickly, you could say this is stress, their EEG dropped. Notice what I'm pointing out, the interaction between breathing, respiration, and diet. That's all. And remember, the most recent research now for Alzheimer's suggests the following, that a cofactor in Alzheimer's, at least in rat studies, is that if you take rats, you give them lots of glucose, And let me start. You take lovely rats, you train them nice on a maze. Now you give them glucose. You interfere with the insulin metabolism. All of a sudden you get the amyloid plaques within 2 weeks. And they lose their ability to run the maze. That is intriguing. So it looks like in rats right now that rats are maybe not the best model for Alzheimer's, but one factor that contributes to excessive glucose or insulin reactivity may develop amyloid plaques. And the newest model for Alzheimer's, at least as I understand it, is that amyloid plaques are not the disease. They are the body's protective mechanisms to deal with the oscillations of glucose. And this is now labeled type 3 diabetes in the recent research. And so I would think about that, about diet. Like I went, diet, how many ate today? Had your Danish? Aren't they delicious? But you just dosed yourself with pure sugar. And remember, from an evolutionary perspective, we have no upper limit on saying no to sugar. And I mean that. Because for millions of years, almost anything that's sweet in nature gave you calories when you needed calories and was not poisonous. Well, the only thing that I can think of that's poisonous is pica. I don't know if you know pica, lead paint chips? Well, the reason little children love lead paint chips in buildings where there's lead, because the pica tastes sweet. Try it next time. It really is sweet. But that's about one of the few things around that in normal nature, almost nothing that, well, anything that's sweet may give you calories and is not poisonous, unlike like bitter. So we have no mechanism to turn us off. And remember, until the 18th century, you may have, your average sugar intake was maybe 5 or 10 pounds max. And that was partly of honey and other things. And now if you look at the person next to you, you realize they're eating, at least on the average, 160 pounds of sugar a year. That's the American average. It's all mass, whether it's corn sugar. Our bodies have no mechanisms to turn that off, and we have to protect. It may be a major factor in illness. And now if I go back to this slide, just to point out that when you hyperventilate on this slide here we hyperventilate very nicely. What happens at that point in the brain, if you're intrigued, is what happens here. That's the work by Scott Woods. You can see nicely that the cortical circulation decreases nicely. And so no wonder that the students can't think when they get nervous. And if you have this interaction of a hypoglycemic epoch because they ate their donuts, their Cokes, and nervousness because they're sleep deprived, as many of them are, then they're more living in this state, and then we label them. Okay, maybe I'll do a little experiment how it feels. Is that okay? So what I'd like you to do, just make yourself comfortable. Good luck. I'm always shocked that you moved. That means all the time you were not listening to yourself. I'd like you to breathe in a strange way. No hyperventilation, because then some of you could maybe get a seizure or something like that, or if you really hyperventilate for a long time, the coronary arteries would constrict, the cerebral arteries would constrict, who knows what would happen. So I'll be very polite. But I'd like you to just inhale normally, and then when you exhale, I'd like you to exhale only about 60% of the previous inhaled air. So that means I inhale, don't do it yet, let me explain. I inhale, I exhale 60%. I inhale, I exhale 60%, I inhale. Is that clear? So let's just start. Are you ready? Get set, go. So you inhale and exhale only 60%. I think that's probably enough. How many felt some form of fuzziness of thinking, or put your hands up for a sec. Look around. How many felt some anxiety, some nervousness? Put your hands up. How many felt palpitations? More than half to 2/3 of you had major cognitive symptoms. And we did that in 30 seconds. And if you looked at the person next to you, you would never have known they did it. I'm intrigued in these phenomena, and I'm intrigued how can you return health. So one of the pieces we do is we teach people how to breathe differently as one dimension, so their brain does not trigger that fear reaction. And we live in a world often with students who are so fearful. And then diet. I keep wanting to remember this. This is, as you all know, Michelangelo's David. You know, he came to visit the United States, as many of you know. I don't know how many saw him. Any of you? Remember? And then when he came back to Italy, okay? I want to keep this in mind because our diets are totally alien to our biological background. I am not saying you should just do diet. You need to do exercise, diet. You need to feel safe. Many things. But let's think of diet for a moment. For the women, we know that the FDA has recommended that all women before getting pregnant take folic acid to avoid neural tube defect. There's only one problem. Neural tube defect almost did not occur before the 19th century. Because our normal diet had enough folic acid in it. Remember, you were still eating liver, your great-grandparents, all these organ meats. You were still eating vegetables and stuff like this, or root vegetables, or whatever. Keep that in mind. This is really an indicator that we are suffering from chronic, affluent malnutrition. And that's an argument I would make. We need to return. Or the effect of fish oil on pregnancy. That's vitamin D most likely. This is British studies. These are large women populations where half the women get omega-3s. That's fish oil. Remember the cod liver oil you got as a little kid? You know. And look what happens when the mothers during pregnancy get some more cod liver oil. Look what happens to the kids. These are controlled studies, placebo-controlled. All of a sudden, ectopic eczema drops. If I ever get this button here working, here we are. Only 7% versus 12%. That's about a, 40% decrease. Egg allergies drops. About when you start looking at these kind of data, you start saying, maybe our diet is deficient. And there may be hope for many disorders in that way. I put cancer in it because we wrote a book on this. But, you have cancer, you can apply it to multiple sclerosis in a great study. But let me talk about the cancer one with rats. I like this one. Because it applies the interaction between our pollutants in the environment and our non-evolutionary diet. Think what rats used to eat. What did rats eat? They were scavengers. They ate a little bit of everything. The one thing the rats never ate is casein, milk protein. So in this great study, what you do is you give rats a very low dose of aflatoxin, which is one of the most carcinogenic agents known. It will trigger lovely tumors in rats when you've given their normal rat chow, which is an artificial food not part of the rat's evolutionary background. Rats never had milk proteins, and maybe adults neither in humans. Now, all you do in the study is you reduce the milk protein to by 5%, and the tumors do not get expressed. And I'm asking that question of all of you in the same way. The diet you're eating, the life exercise you're doing, how is that part of your past evolutionary background? Okay? Instead, we sit like this. See, we call that stress immobilization syndrome. And that's what students now do. We sit, And in fact, when you're sitting, and more of the recent research, at least in exercise, says the moment you're sitting, you're shifting the physiology in your body, you could say, to rest and regeneration. And now we have a conflict because our brain is saying, the world is dangerous, I have to listen. And it's that conflict that leads you much more to type 2 diabetes. So if you're going to be active, stand up and wiggle. Or we read like that. And this is how families live together now, often. And remember, I want to keep in mind how much screen time children now use. I think all of you know that at school. Notice they almost no longer do any outdoor activity. And yet, go back in our evolutionary background, we were doing outdoor activity all the time. And when you watch the computer for a while, more than 4 hours a day, at least in children, they no longer can recognize basic human emotions in research studies. So I think that's an intriguing idea. Okay? And then remember, at present, we spend less than 5% of our time outdoors, 95% indoors. The opposite ratio in a way. We probably spend 50% outdoors and 50% indoors. And remember, nature, experience of nature is critical for health. A very old study done, 48 patients who had gone gallbladder surgery, patients who had a view with a room of a tree, left the hospital a day earlier than those who saw a brick wall. These are highly controlled, that's pretty good studies. There are many of these now, and also need much less medication. How many of your children you treat, patients you treat, or I work with, my students, spend time outdoors and play? I highly recommend, if you don't know this concept or not familiar with it, I recommend the book by Love, L-O-U-V, called The Last Child Out of the Woods. Okay, and then finally, electronic media. Every hour of TV watched per day by preschoolers increases by 10% the likelihood that they'll develop concentration problems and attention disorders by the age of 7. Journal of Pediatrics. And this is how many of us are now living. It's the last thing we do. We use our iPad, our cell phone, we go to bed with it. And I'm not even arguing that I could argue that possibly the electromagnetic field may increase the risk of neurogliomas by about threefold. But look at the sleeplessness from this. Let me explain this graph. This is daylight. In the morning, we have lots of blue light outside. In the late afternoon, evening, we get red light. But this is the normal light of sunlight. This is your computer screen or your fluorescent screen, fluorescent lights. We forget that light acts as a medication in our bodies. And if you have jet lag, you can reset biological rhythms with light. And now look what happens. When you're exposed to blue light, melatonin is suppressed in your body. You suppress melatonin production. It's most critical. When you're watching your iPad, your melatonin production is significantly interrupted. Now you say, so what? The only distinction is children who watch screens, especially the backlit screens, have much more disturbed sleep, and common to almost all attention deficit, or 50% of attention deficit disorder children, is sleep disturbances. This is just pure mechanics. And look what happens to the influence of light on melatonin at night. Historically in the summer, shorter night, you get a compression of the biological rhythm. In the winter, it spreads out a bit. And now I go to the bathroom. Remember, for those, you turn the light in the bathroom, you cannot go back to sleep easily because you have just suppressed your melatonin rhythm. One of the treatment strategies we now use from this, sleep in total darkness. Total darkness. That means not even that bluish glowing light of the charger. It's called sleep hygiene in some ways. Total darkness. If you do that, you see a significant improvement of people with their insomnias and some of the other disorders. Okay? So if you look at self-illuminating devices, which is now what we've moved to, we moved from the Kindle with the white paper to the Kindle with the backlit light. Those self-luminous electronic displays suppress melatonin by 22%. Most children need more sleep. They don't need less sleep. Most adults need more sleep, not less sleep. Okay. And does this have any effect to other illnesses? Disruption by light affects our circadian rhythms. That's the most important part. And by interrupting of our circadian rhythms, a number of illnesses will start occurring, including cancer. Which one can show that cancer patients have disturbed temperature circadian rhythms that's absent, and their core temperature is lower. But here you see a nice animal study where we show the same thing, and where you can see very nicely, these are rats with human breast cell xenografts. You keep the light on the whole night, oops, you get more cancer. You turn the light off the whole night, have in darkness, the cancer growth is much less. Notice, light is a potent agent and interacts. Okay. And then, as I said, we move less, our energy decreases. So now going back to the little study we just all did, which you did. Remember in the room here, I asked you to do cross-crawl movements. What is so interesting is that when you do this with students, and we have done hundreds of those, what you can see very nicely, I could have asked you to rate your energy. And you get an arbitrary rating here. And now we do another walk. Well, all of you stand up. Now I'd like you to walk differently. I'd like you to walk, let yourself collapse a bit, go like this, and just shuffle in place. You know what happens when you have been a couch potato for a while? You sort of walk, you see the clients coming in, you put them in a lazy chair, and they're sort of sitting in this collapsed position. And I would say very few of you, your energy went up. Am I correct? Now, because you might as well get your energy back up, find another person for a moment. Just for an instant. And then put your backs together. You want to be my subject for a sec? Put your backs together very nicely. I know, I can do it from California. And now just give the person a massage. Thank you. That's enough. Note the first walk, that kind of movement, got you more depressed. Your energy went down. The second, I don't quite know how to recommend this at the work site or in school, got your energy went way up. But we have done exercises like this with students combining the diet, lower breathing, and some conditioning, and all of a sudden their scores go up by at least 1 grade on exams. But here's the data. When you do this in large groups, in balanced design, half the group gets slouch first, and half the group gets the exercising cross-crawl, not the back rub. And you see there's a slight decrease in energy. I don't know which one works. Neither are very superb. Here you see this, the level. Here it goes down a tiny bit. Not significant. It is significant statistically, but not very much. And it goes up. But what is interesting, if you break the groups in half, or you take the group, the 20% who have a history of depression, who say, as students, I am mainly depressed a lot. And you take the people who say, I'm never depressed. You pull the data out, and now what you see is something much more interesting. And that is the people who, if I ever get this thing to go, here, the person who says, I have never been depressed, there's no difference between when they walk in a slouch position. But what is very noticeable is the people who have a history of depression, when they walk in this slouch position, their energy drops significantly. They get much worse, just in body posture. And the argument I want to make, and when they found the cross-crawl, by the way, they all go back up again. And these are, balanced design, half get it one at first, then back and forth. So this is the summarized data. But this really suggests that it isn't just movement, if there's an interaction, if you have a history of being depressed, helpless, powerless, you put your body in a body position, then that will amplify your symptomology. So I have now really changed again and say, gosh, not only do I need to deal with food, not only do I need to deal with cognitions, not only need to deal with people how to feel safe, I need to teach them how to move and be in a different body posture. And when they do that, they have much more energy and their thinking works better. And when we have observed people who have at least some people who have learning disability, I'm impressed by the early work by Jane Ayres of sensory integration. But in our own recent work, when we do this little study again of cross-crawl, do it one more time. Stand up. Just do cross-crawl for fun. It's crazy. And could you come up here for a sec? Is that okay? No, the person next to you, the man. Just jump out here. And just do it with me. Just do it for me for a sec. Just do it. Good. Thank you. What you all saw, he didn't do cross-crawl. Cross-crawl is a pattern, learning crawling, which we do when we learn about 6 to 9 months. We developed a motor coordination. And what you did was homolateral crawl, which is a movement like this. And if you ask your clients to do this, many of them who have learning disability, you'll see when you spontaneously ask them to do cross-crawl, jumping place, they'll go like this. Because it's really a breakdown in motor development. And you can when we reestablish that, at least in the few subjects we have been working with, all of a sudden, their thinking is clearer. I'll let you sit. So a person is disturbed, their thinking isn't clear, they're hyperactive. We force them to do this. All of a sudden, for a moment thereafter, their brain seems to work better. It's no good data, by the way. Just food for thought. But I'll promise you that many of your clients, if not most, compared to healthy clients, tend to move to homolateral crawl under stress, which is really a breakdown of physiology. Okay, I could show that in video clips. Remember that exercise helps depression. This is a note. There you are. You know, that patients who take Zoloft versus exercise, the outcome data is much better, by the way, for exercise than for Zoloft. I would highly recommend that instead. And how many of you take patients halfway in a session and do exercise to get their energy up? Mostly we put people in a chair, collapse like this, looking at the screen, trying to press buttons. I'm exaggerating. But I'd like you to do a little experiment for 1 minute. I'd like you to sit in your chair. I'd like you to collapse a bit like this and look downward. So if like you collapse, while looking downward, keep looking downward, I'd like you to only recall hopeless, helpless, negative memories, one after the other. Don't worry, no laughter, look, say in the collapsed body mode. And now, without changing your position at all, just think of only optimistic, positive memories, one after the other. No, don't change your position. Good enough. Now I'd like you to sit up. Really sit up. Arch your back a tiny bit. Look a little bit up. You can do it. And now, while looking a bit up, I'd like you to just think of hopeless, helpless, powerless, negative memories, one after the other. And now I'd like you to shift and just think of only optimistic, positive, empowering memories, one after the other, looking up. Anyway, how many noted that looking down you had easier access to hopeless, helpless memories? I think almost all of you. We published a study. Sue Wilson and I published that study, so it's documented. But notice body posture interacts with access to cognitions. You can amplify one or you can lower one. Okay, we just did that. And finally, remember how you walk. If you walk in nature, you get more energy than walking in the shopping mall. And then remember what fits better in your busy schedule. So we have disrespected our lifestyle. We have forgotten our evolutionary origins. We are part of an intricate web of nature that includes the diet, movements, parasites. Any of the foods you eat, ask your great-grandparents, can they recognize that food as food? If the answer is no, don't eat it. Movement needs to be part of who we are, and we need to return and accept that we are part and live in mutualism with all our parasites. I can show many slides of how this can benefit students, and we do. Here's results of 132 students who get much better by taking this kind of approach more. I won't go through all of it. Or you can read it in more detail. That's an ad on this. And maybe I'll end, if I can have 3 minutes, no? 3? Then I'll end with a movie, if that's all right. Because I truly believe that for any patient, there are possibilities if you look at the strength of us. So on that mode, I will stop with this video clip. I'll have to turn off my little man that will interrupt me all the time out of stretch break. I'll get rid of this one as well. Because I really believe everyone, regardless how sick what label we may have, we can be our personal best. And I want to end with that for myself.
So as you could see, the young woman had lost her arm, and sometimes we don't even see that. And the man had lost his leg, and he was not a dancer before, but with practice he did. And so each of us have possibilities, and maybe that's it. And our possibilities are enhanced if we respect our evolutionary origins. Because really, we are just mammals, and we follow the same rules, and our health will be improved. Thank you very much. I realize in the case... And I'll be around to answer questions, but I realize in the case of the program, the next speaker will be up, but I'll be around during lunch or other times. Thank you.